will arrive in Indiana next week. Our ALYSSA Donovan spoke with local health experts about what the vaccine means for you and the state of the pandemic moving forward.
Next week, more than 55,000 doses of Pfizer's COVID-19 vaccine are expected to arrive in Indiana. But that doesn't mean stop wearing your mask or stop social distancing. Experts say it will be a while yet before we return to any kind of normal.
I would be first in line to take this vaccine if it were offered me today.
Tom Dzinski is the Director of Epidemiology Education at IUPUI. And like many of us, he will not be the first or the second in line to be offered the vaccine. The state will start by distributing the vaccine to frontline healthcare workers.
Protecting them is going to be really important in making sure that we have hospitals and clinical settings up and running.
Because of the limited doses, experts say it will likely be months before we see an impact on COVID numbers. The vaccine requires 2 shots over the course of 28 days to reach full immunity. The first delivery to Indiana will include 55,575 doses.
That's only enough to vaccinate 27,000 people.
Dr. Cynthia Brown is heading up the AstraZeneca trials at IU School of Medicine, and she's well versed in the status of the other vaccines, Pfizer and Moderna. She says the goal of all the vaccines is not to eradicate COVID-19, but to slow the spread.
We've only ever had one successful vaccine campaign that eradicated a disease, and that was smallpox.
Slowing the spread depends on reaching what's called herd immunity, a large amount of vaccinated people within the population.
This vaccine is 95% effective. So we actually need to vaccinate more than 70% of the population because we know 5% of them won't develop enough antibodies to protect them.
But it will likely be a long time before we get to that point.
We have a healthcare worker population that's 350 to 400,000 individuals. So it's going to be a while before we get those doses.
State health officials expressing uncertainty about just how many more doses are on the way.
We anticipate receiving additional vaccines every week, but we do not know what those amounts will be.
I'm confident by saying this time next year that we'll be, all together for Christmas again.
As of now, it's too early to tell how long immunity will last in those who are vaccinated, or if this will be the type of vaccine that we need to get more than once. I'm ALYSSA Donovan, WRTV.
We requested and received the state's COVID-19 vaccine plan in October. So as ALYSSA just mentioned, the Department of Health says its vaccine allocation committee prioritized the healthcare workforce and those people who are at greater risk of death from the virus for phase 1 of the COVID-19 vaccine distribution. Among the general population, long-term care residents would be prioritized. So would people with underlying medical conditions, those who are 65 years of age and older, people at risk for severe COVID-19 illness, those at risk of acquiring or transmitting the virus, and people with limited access to vaccination services. State health officials say they expect most of the general population to get vaccinated in the spring and summer. Tonight,